Hi, my name is Tianyu Shea. I'm a third-year medical student at the New York Institute of Technology, and you're listening to Do or Do Not. If you don't know what we're about, I highly suggest you listen to our introduction where we go into exactly who we are and why we're making this podcast. Basically, in this podcast, we will interview osteopathic physicians. We will speak to them about how they became interested in osteopathic medicine and medicine in general, how their education and experiences in medical school shaped their interests as a physician, and examine their journey through residency and fellowship into practice. We will look at amazing individuals who have done incredible things, from starting large family practices through which have touched 3 generations and thousands of lives, to hospital administrators who have changed healthcare systems and the way that medicine is practiced in the United States. These interviews will not only explore important controversial topics in medicine, but delve into the physician's individual field and experiences, sharing their perspective, knowledge, and insight into modern medicine. This podcast is geared towards osteopathic students, but we believe it will be a valuable resource for all healthcare students, pre-medical students, practicing physicians, as well as anyone interested in the physician's journey. These are the trials and tribulations of becoming a doctor. Welcome back to our second episode. We have an amazing guest on board today. Dr. Matt Nelson is an emergency medicine physician who received his Doctor of Osteopathy from NYITCOM in 2001 and trained in emergency medicine at North Shore University Hospital in Manhasset. He was selected as chief resident in his final year and subsequently completed a fellowship in emergency ultrasound. In addition to his numerous publications, he became program director of the prestigious emergency medicine residency at North Shore LIJ-Zucker School of Medicine in 2014. As program director, Dr. Nelson has selected and trained hundreds of EM physicians, both DO and MD, over his career. By reputation, both medical students and residents feel that their love of emergency medicine was fostered by Dr. Nelson and feel that their training would not be complete if he was not there to guide them in their training. Today, Dr. Nelson will not only shed light on his personal path to success, but he will also give insight into what a residency looks for, particularly for osteopathic students, especially with the new changes recently instated by the NBME and USMLE. Dr. Nelson, we're so glad you could join us today. Tell us, when and how did you become interested in medicine and decide you wanted to become a doctor?
I was interested in becoming a doctor since very young age, and I can't honestly give you an answer as to why. There was no doctors in my family. I was always a stronger math student than science student, but I always had the desire to become a physician. Liked science, and I think that interest in medicine just grew as my time in school continued.
Can you tell us a little about your beginnings? Where did you go to undergraduate school? And were there any experiences there that led you into medicine or osteopathic school?
I went to undergrad at Cornell University in Ithaca and studied neurobiology and behavior there. Honestly, as far as pre-med goes, it was a lot of students in big lecture halls and was not ultimately a warm or encouraging place to be pre-med. I was fortunate enough to have a few older fraternity brothers who were in pre-med at Cornell, and they really helped me through some of the hardships that a pre-med student goes through. I honestly did pretty well when I was at Cornell. I think my GPA was somewhere north of 3.6, and I did well on the MCAT, but at the time I applied, it was very, very competitive to get into medicine. There were 6 medical TV shows on prime time, and I applied to probably 35 different allopathic med schools. I interviewed at 2 or 3 and was waitlisted at 2, but ultimately I didn't get accepted to any of the schools I applied to. I wasn't familiar with osteopathic school at the time, and ultimately I decided to spend a year teaching biology and earth science at a high school in Brooklyn, New York. That being said, I still ultimately wanted to become a physician. I spoke with a friend of my brother's, Michael Gutenberg, who at the time was a emergency physician in Brooklyn, and he went to NYITCOM and he told me about osteopathic school and osteopathic medicine. And honestly, it sounded like it was pretty cool, and he was a good guy and had been successful in his pursuit of becoming a physician, so I looked into it. And the following year, I applied to much smaller amount of schools, I think 8 or 9 schools, and I got into NYITCOM and I accepted it, and the rest is history. I think that my education at NYITCOM was second to none, and I think that it prepared me immensely for the physician that I am today.
How was your experience at NYIT? Are there any specific people who you met in school who were special?
My experience at NYITCOM was great. I think that the teachers really were invested in the students, and the classes were challenging, and they really prepared you for your clinical time. One teacher in particular, our pharm teacher, Dr. Bob Mancini, was truly formative in my career. I look back now on drug choices and drug-drug interactions, and I can still hear Dr. Mancini talking about the various drugs he was teaching. And he really was the type of teacher that changes somebody for the better.
Did you do any research while at NYIT?
Didn't do any research during medical school. I took the normal courses and I did fairly well. I was able to succeed and get into the Osteopathic Honor Society.
What about your clinical years? Where did you do them and what did you think of them?
I think that our ability to do our clinical rotations at so many different places, at first where I saw it as a negative, was ultimately a positive. It really allowed me to become much more adaptive to my environment and allowed me to succeed regardless of where I was being taught and where I was performing. And I think that that's truly a strength of any physician.
So how did you ultimately decide on the emergency medicine specialty?
I decided that I would ultimately go into emergency medicine. I knew from pretty early on that I wanted to go into emergency medicine. I was a volunteer at Bellevue's emergency department in college, and it was something that I really found enjoyable. I thought that the experiences in the emergency department were really second to none. You were constantly working on undifferentiated patients, which is what I like most about medicine in general. And there were quick decisions and ultimately quick responses. And I found that what was done in the emergency room often carried on through the entire hospital course, and that really attracted to me. In med school, I kind of went in with an open mind, but nothing ever swayed me in deciding on going into a different field. At the time, emergency medicine was done only in your 4th year of med school, and we were only allowed to take 1 4-week rotation. Knowing that I was going into EM and that I wanted to showcase myself, I decided to kind of manipulate the system a little bit, and I did 4 different rotations in EM. I did toxicology EM, I did peds, emergency medicine, so I kind of was able to showcase myself at different places without taking more than 1 formal rotation.
And what about this big step 1 test that everyone is worried about? Did you take it?
I didn't actually take the USMLE. I only took COMLEX, and as a program director now, it's not what I would advise. I think there's nothing wrong with being a little bit stubborn and saying this is the test I took, but many more program directors are more comfortable with the USMLE scores than the COMLEX scores. So to increase your chances of matching, I would recommend any student currently applying to EM to actually take both.
How was your application process to residency? What factors played into you deciding on the residency that you did?
I actually decided to apply to only the allopathic emergency medicine department's residencies in New York. I knew I wanted to stay in New York. My wife at the time was also a med student applying for internal medicine, and we knew we wanted to stay in the New York metropolitan area. So at the time, there was only one osteopathic EM residency, and there were about 12 or 13 allopathic residencies. So just playing the numbers game, I decided I would be applying to the allopathic residencies only. So I applied to all 13 New York EM residencies, and I think I got interviews at 9 or 10 of them. Ironically, the one place I didn't get an interview at was Bellevue, NYU, who at the time just didn't take any DOs into their EM residency program, which was funny because 2 of my 4 letters of recommendation were from people very high in the NYU education system. Ultimately, I was offered a spot at North Shore University's EM residency program, actually outside of the match, and with some thought I accepted it and haven't looked back since, and it's been one of the best decisions of my life.
While we're on the subject of selecting residencies, if an applicant was deciding between a large or small institution / private or public institution for training, how should one go about selecting which one is good for them?
There really isn't a good answer for how should I decide between a private or public training program or a large or a small training program, because honestly it's going to depend on the applicant, not the training program. You know in what environment you're going to flourish, and really there are a ton of great programs, and you just want to put yourself into an environment where you're going to succeed. You can succeed in a community small program or a large urban program. And it really doesn't matter where you do your training as long as you put your effort into it.
Going back to your residency, what was that like? Was your experience different as an osteopathic doctor?
So my residency training was unbelievable. I think that I got a great training at North Shore and really learned how to be a master clinician. Honestly, once I got through the door, no one really cared that I was a DO and not an MD. My 7 other residents in my year all functioned the same way, and I think that no one cared about the initials after my name once I started residency, which is interesting because it really was a factor in my pursuit of medicine up until that point. As a DO applicant and a DO medical student, I always felt that I had to be the most prepared in the room, work the hardest in the room, and do the most in the room. I definitely feel like I came into residency with a little bit of chip on my shoulder. I think that made me want to do better and be a better doctor and excel in everything that I do. And honestly, I think that that holds true for a lot of the DO applicants that we see. A lot of them come in with something to prove, and that just makes them, I think, a better doctor.
Do you have any stories, any mementos from residency that you would like to share?
I have 2 stories from residency that sit with me. The first is from my second year in residency, and I was working in the PDM at North Shore and was evaluating probably a 8 or 9 year old who had been struck in the head with a baseball. And he seemed okay. He had a little bump on his head, but otherwise seemed okay. And while he was in the ED, he deteriorated and he became unresponsive and was ultimately found to have a head bleed, an epidural hematoma. So we had to intubate him and get him to the operating room. And I was at the head of the bed doing the intubation. His father was an anesthesiologist and his mother was a neurologist, and they looked at me and said, "Are you sure you have this?" And I looked back and I said, "Yeah, I'm sure." And I intubated the kid and he got upstairs to the operating room and did remarkably well. And I remember going up the next day and just getting a huge hug from his mom and dad, and that was unbelievable. The second thing that I remember from residency was my medical intensive care unit rotation from my intern year during residency. And ultimately, I was paired with a senior internal medicine resident, and that resident was actually Dr. Ian Storch. I just remember learning a lot from Ian and having a great time doing it, and I think that experience really formed a great relationship between the two of us. And I think that's one of the great things about medicine in general. You work with people, and because of what we do and how significant it is in people's lives, the bonds that you make with people are really, really strong.
Did you get any advice throughout your education that you sometimes reflect on and you'd like to pass on to other students?
As far as advice for people going into emergency medicine, one of my mentors and friends, Dr. David Lee, once told me that in order to be a successful emergency medicine doctor, you have to have 2 of 3 key traits. You need to be either very fast, very nice, or very smart. And you had to have 2 of these 3 traits to be successful. So you could be fast and nice and not that smart, or fast and smart and not that nice, but you needed 2 of them. And while I try to be all 3 most days, I'm always fast and I'm always smart. So take it for a grain of salt.
Kind of moving away from the content of your education, did you take any loans? Did finances ever affect your choice of residency or specialty?
I did have to take loans for medical school. I was fortunate enough not to have any loans from undergrad. But yeah, I think that it's the norm. Most people need to take loans to go through medical school. Both myself and my wife went to NYITCOM, which was fairly expensive medical school, and both graduated with a large amount of loans. I don't think at any point the amount that we owed came into the decision making of what specialty we were going into. And ultimately, when you finish med school, you're going to be able to pay off your loans, sometimes quicker than others. It was important to me and my wife to pay off our loans as quick as possible. I think that physician makes a good living regardless of the specialty, and we were both doing well, so always paid a little bit extra in the beginning to decrease the amount of principal that we owed. And then over the years, as we became more established in our careers, we paid a lot extra. And ultimately, we were able to pay off both of our 30-year loans in about 13 years. So I can say with a large smile that we are debt-free at age 43, which is no small affair.
How was your experience after you graduated from residency? I know you did a fellowship in emergency ultrasound. How did you end up with that decision?
Once you're finishing residency, Finding a job is not that difficult. It's just figuring out what job you want. I decided probably somewhere in my second year that I wanted to pursue an emergency ultrasound fellowship. I got to work with legends in the field like Mike Blivis, and I decided that I wanted to be the type of physician who was able to diagnose something at the bedside using ultrasound. We were very early adapters in point of care ultrasound at North Shore, and it became part of my practice. I couldn't see not becoming an expert in the field. So ultimately, I applied for the fellowship at North Shore, which was one of the first fellowship in emergency ultrasound at the time, and I was accepted just with a handshake from the fellowship director. And after I finished fellowship, the chair at the time asked me if I wanted to stay on, and I really loved teaching. I loved it my entire life, and I wanted academic emergency medicine to be part of my career. And so my residency interviews was really the last interview I ever sat for, because I finished residency and did a fellowship at the place that I trained, and then became an attending physician at the place that I trained. I think that when you are making a decision of what residency you're going to choose, you should have that thought in the back of your head. It may be a time where you want to go and see things that you'll never see before, or do things that you'll never have done before in different environments. But many people stay and work in the same hospital or area that they train in. So if you see yourself staying in New York when you're a attending physician, then you probably should do a residency in New York.
Can you tell us one thing that made you successful in your career? A superpower, if you had one.
I really don't have any superpowers, but I like to think that I have had a successful career so far. I think that my success comes from my work ethic, honestly. I've always wanted to strive for excellence and not accept anything less from myself. And I think that perseverance in my training and my education has led to my success. I'm a pretty big guy and a very loud voice. And honestly, that hasn't hurt. But over the years, I've learned that sometimes quiet is better than loud. And you grow and you adapt. And I think that ultimately, if you're always prepared and you always give your all, you're going to be successful in what you do.
What if you didn't do emergency medicine? Based on what you know now, what would you choose if you had to?
So if I had to choose a different specialty, that's a tough one, because I can't honestly see myself doing anything other than emergency medicine, mostly because I can't stand rounding. But looking at what I enjoy about emergency medicine, I think that I probably could have been very successful with critical care. I think they share a lot of things, including the acuity level of our patients, and being both cerebral and procedure heavy. I think that if I didn't do emergency medicine, that probably could have been a very successful critical care physician.
Do you personally believe that your success in your medical career is secondary to intelligence and hard work, or do you attribute it to luck?
So I think that the success I've obtained in my medical career is secondary to a lot of things. I don't think luck has anything to do with it. I think luck is what you make out of the situations that you're placed in. I think that hard work, trying to always be the smartest in the room and the one that works the hardest in the room, has led to my success. You're not always going to be the smartest, because you can't control that, although you can try. But if you come in with that inherent work ethic, I think that that's going to lead to a tremendous amount of success.
Do you think your path would have been easier if you were an allopathic MD rather than a DO?
So I honestly don't think that my path would have been better if I was an MD. Like I said before, I think the fact that I didn't get into med school the first time and it wasn't a cakewalk and I had to prove myself over and over again has made me the physician that I am today. So there's no regrets. Maybe it would have been an easier path, but honestly, I don't think I would be the physician I am and have the success that I have today if I had gone to a MD school rather than a DO school.
While we're on that topic, do you think that the fact that you are an osteopath adds in any way to your practice of emergency medicine?
I don't know that being an osteopath adds in a huge way to my practice of emergency medicine. I laugh when I think about it, but I had a patient with back pain my first year as a resident, and I actually did osteopathic manipulation for the pain in the ED. And it worked like a charm, but it took me like 25 minutes, and I had a ton of patients build up in the chart rack. So I'm not sure that manipulation has a huge part in the emergency medicine setting. That being said, I think that my manual dexterity and my palpatory skills certainly are stronger because of the training I had. I think that I'm able to palpate for a lumbar puncture space with a lot of ease, and there's a lot of things that I think my osteopathic training has strengthened my clinical practice in that facet.
Thank you for sharing your story, Dr. Nelson. I'd like to move on to common questions that an applicant would have for a director of an EM residency. The first being, can you give any advice to students who want to get a good letter of recommendation? Even more specifically, to EM applicants, a standardized letter of evaluation or a SLO?
As a program director, the advice I would give students who are applying to EM are showcase yourself. Do as many EM rotations as you can. I would say 3 or 4 at different types of places. And when you're rotating at those places, be an asset. Don't be a hindrance. And that doesn't always mean having to carry a huge patient load. It means helping a resident or attending out by letting them know that labs are back or the CAT scan is back, talking to patients and making them comfortable. Everything that you can add while you're working clinically is going to translate into the residency program directors thinking that you will make a good resident in that program.
Are there any electives outside of emergency medicine that can benefit an applicant?
If you are going into emergency medicine, some electives that may benefit you are critical care in the ICU or anesthesia, but ultimately the most bang for your buck is going to be things in the emergency department. So fringe rotations like emergency ultrasound, toxicology, sports medicine. These things can really help you get into a place without doing an emergency medicine rotation. And I think that would be my advice. Look for rotations like that.
Can you tell us a little bit about the pros and cons of shift work?
Well, you can't talk about emergency medicine without talking about shift work. It's part and parcel of the field. I actually was a nocturnist for the first 10 years of my career, meaning I worked the overnight shift, and honestly, it was probably the best decision I ever made. Very few professionals can say that they were always able to have dinner with their family. When my wife and daughter were sleeping, I was working. So the only thing that I missed out of their lives was honestly them sleeping. So I have no regrets. Shift work can be challenging, especially when you're jumping from nights to days, but you learn how to do it. And like I said, it can be advantageous because there can be a ton of extra time in your life to spend with others. Obviously, it can be difficult and you need to make adjustments, but that's what doing a residency prepares you to do, is make those adjustments.
What are your thoughts on emergency medicine burnout?
Physician wellness and burnout are huge buzzwords. especially recently, and I don't mind talking about them, but honestly, I truly believe that the thought of emergency medicine burnout is grossly exaggerated. I think that all physicians, regardless of the field they're in, experience burnout. I think that the challenge is on an individual basis to figure out how to get past it, right? So we all experience burnout throughout our career, and it's not something that happens after 10 years or 15 years. It's something that happens on a regular basis. And figuring out as an individual, well, watching Supergirl with my daughter or going to a nice dinner with my wife, that gets me back from my burnout. When you figure out what kind of cleanses your palate, what recharges you, then the idea of burnout's really not that bad, because you can get burnt out and then get re-engaged with your career, and finding that work-life balance is what it's all about.
Thank you for those words of wisdom. For our last couple of minutes, I wanted to shift gears and talk about more recent news in regards to matching. As I'm sure everyone has heard, the USMLE recently changed Step 1 to pass-fail. What are your thoughts on this as a program director?
So I think that the question is timely, and they just announced that the USMLE Step 1 is going to be changed to pass-fail, which ultimately I think is the right decision. But I do think that as a program director, it's going to increase the level of difficulty in evaluating residency candidates. And the reason is because as a program director, we have to evaluate over 1,000 applications for 10 to 20 spots. So that number kind of gives you a sense. I don't think that number ever defines somebody, and I think that someone who scores 255 is not necessarily going to be a better resident than someone who scores a 230 or 220, but it gives us a sense on a level of success. Ultimately, how a person interacts is going to be the most telling. So I think the fact that USMLE is changing to pass-fail will make your rotations and electives in emergency medicine even that much more important to where you match.
Do you think that this makes it a bigger issue for osteopathic students who wish to distinguish themselves?
I don't think it's going to be a bigger issue for osteopathic students. Honestly, with the joint accreditation, I think that at least in emergency medicine, the DO thing is falling by the wayside, and I think that at the great majority of programs, a good DO applicant is just as competitive as a good MD applicant, and I think that says a huge amount about where we've come over the last couple of years, and by couple I mean the last 20 years.
Well, Dr. Nelson, thank you so much for taking the time to be with us today. We really appreciate your story and your insight as the director of an emergency medicine residency, especially with this recent huge change.
Pleasure to talk to you, and keep us up. I think it's a great thing.
This concludes our second episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there is someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We are currently working on a plethora of different interviews, ranging from neurologists to interventional cardiologists to osteopathic deans of allopathic schools. This is Tianyu Shea, OMS 3. Thank you guys so much for listening to Do or Do Not.